Yeah. As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up. Fall down, I just gotta get up, yeah. Cause this is my road. Let's camera action.
Harry, I'm expecting you to say that welcome to the Tom Ficklin Show, but you haven't been saying that lately. So I think you're putting the burden on me.
Well, you've been jumping in,
Okay,
so
well, let me hear it, man. Give it to me.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Now that's what I'm talking about. Your home for community radio. And we're going to be talking about community participation and community radio in terms of community communication. Just what does it mean to kind of communicate to the community about everything, not just who's president or how the stock market is, but what are we feeling? What are we thinking? How are we responding to issues and really just life in general? And really my guest today, although we're not going to be that metaphorical, but we are going to talk about issues that are so important about what sustains life. So Bernard Macklin, Lily Bella Soria, did I get that generally in the general range of?
Perfect, Tom.
Yes, sure. Selena Ayala, Jessica Newsom, and Arjun Venkatesh. COVID. I mean, really, I was struggling, Lily, and I'm going to kick off with Dr. Bella Soria. Struggling with the title for today's show. And what I came up with was, I mean, we did talk about some possibilities and everyone's prepared to speak, but how do we make sure that there's not a COVID-20? And we hear this word COVID-19, but what do we have to do now and for whatever long it is, however long it might remain, to make sure that it's only COVID-19 and that we don't have a COVID-20? So Lily, jump in because Dr. Bella Soria, because it's important for any solutions, I think, for humanity, for civilization. How do we reach that kind of a consensus on taking collective action? We got to hear from everybody. Everybody's vote matters. So it seems to me, Lily, talk about your research and your commitment and your team here online with Selena and Jessica and Bernard and Arjun. We're going to kind of also weigh in about what's involved with having a team effort for really global salvation. But let me get stopped there. Enough of my soliloquy. And Lily, jump in.
Tom, thank you so much for having us. We are all big fans of the show here, listening to Tom and Harry on Mondays and Fridays. So we're so grateful to be here and be in community with you all. And Tom, you hit the nail right on the head, right? That we have been through such devastation in the past year and a half, but we have also seen here in the community incredible resilience, hope, and a sense of united strength here in New Haven. And exactly like you said, the group of individuals on this call, we're all part of a phenomenal research team at Community Alliance Research and Engagement and Yale New Haven Hospital with Dr. Venkatesh. And we really set out to listen to the community and hear what their concerns were, hear what their needs were, because we know here at CARE, we are so much stronger when we work together through challenges and when we listen to one another and hear what the concerns are. And that's just a little bit of what we'll be talking about today. I would love to hand it over to our brother, Bernard Macklin, to share more.
You know, the funny thing about it, Tom, and everybody that's on the call is I want people to recognize that they have a choice. Making quality choices in such a time like this is key to success, not just for individuals, but for all those that are involved. When I think about the choices I make, not just for my family, but when I leave out my doors, and I have to make that choice for my neighbors as well, because I speak and I'm in their vicinity, I'm nearby them, I walk up on them, I'm breathing on them sometimes because we're so close. And every time I open my mouth, I take a chance of passing on this serious virus. That has taken the lives of thousands and thousands of individuals throughout the country and throughout the world. And so I want people to recognize when they're sitting back thinking, should I get vaccinated? Should I take that step out and get vaccinated? Well, I want you to think about my life when you think about making that choice, as well as you think about yours. And people say that, yeah, getting vaccinated, you might get a little sick or you might get a little weary and all of those things. All those things may be true. But one thing that I leave for people to understand that I'd rather get a little sick than to be dead. Come across a more serious medical conditions other than just feeling a sour stomach. So getting sick shouldn't be the only reason why someone should choose not to get vaccinated. I won't force it on you, but I really want people to think about that really closely when you're making that decision. Yes, the decision ultimately is yours, but I sat back and I listened to Dr. Silvestri's presentation last week, and it's something that he put at the end of his presentation that caught my attention. And that was, he had a family, and the family was conversing amongst each other. The parents were conversing amongst each other. Should we get vaccinated? Well, I really don't want to get vaccinated. I heard this and heard that. But throughout all of that, all of the media and everything that's been put out there, they started to say, well, maybe we should get vaccinated. But the problem was the husband died because he didn't get vaccinated quick enough. So now that family's left without a father because they were thinking about, should I get vaccinated? People need to understand that this is a real virus. This is not a game. This is not something made up. This is not something people playing with your lives or trying to take advantage of you or send you on a false presentation. This is real. This is something that has taken the lives, like I said before, of thousands of people. And so when you make that choice, should I get vaccinated? Think about your life. And think about that father that was thinking about, should he get vaccinated? He didn't make it. And now that family's left without a father. Go ahead, Tom.
No, go ahead, please.
I don't want people to take this as a game. We've watched many things happen, and yes, mistakes has happened along the way with Johnson & Johnson due to women, a few women that came across and had blood clots. And not to say that these things doesn't happen, but you think about the thousands of people that have taken the Johnson & Johnson, including myself, that is still here talking to you today. But the thing is that yes, things happen, and we're sorry for those very fatal situations that happen. But that shouldn't stop the fact that we still should get vaccinated to prevent even one more person, not the 7 women that passed away due to blood clots, but one more person passing away from this virus because of a failed decision that they could have made today. So I leave you with, get vaccinated. It is the right thing to do. I'm not playing with your life. And look at me. We're dealing with a population of hesitancy amongst Hispanics and African Americans. Look at me. I'm African American, and I'm saying it is.
Amen. Lily, just before I go to Selena and Jessica, just give us a little bit of the context also, because as Bernard mentioned, you and your team, you spoke to community residents, and they're aware that this is a life and death situation, but they also share with you their sentiments and their feelings, and I don't think we can discount that. So kind of position us, if you will, in terms of some of that, the listening sessions that you have, and I believe you have some upcoming, because it's so important as we kind of research involves all of us, not just some of us in the academic tower.
Absolutely, Tom. So we have the privilege, this team from CARE, to listen to almost 80 community members here in New Haven, Connecticut, about their thoughts, their concerns, their perspectives on the COVID-19 vaccine, as well as access and acceptance of that vaccine. And people really shared with us, as Bernard mentioned, they wanted to be listened to, they wanted to be heard, and that it was so important as partners in New Haven that we provided spaces for those listening sessions, and that they weren't just one and done, but ongoing listening sessions that were occurring. And then to just give a little bit of a flavor of what Jessica and Salina will be talking about today, the community shared with us that there is so much power in La Familia, in families, in communities, going with you to get vaccinated, helping you to get signed up, helping you to feel more reassured in your decision. And then 3, the importance of having your questions answered, knowing you have a safe space to ask questions, and knowing that you have choices, as Bernard mentioned.
Jessica, please. And Arjun, I haven't forgotten about you. You're a humble soul. You're a patient soul. So, your day in heaven is going to come. Just bear with me for about 10 more minutes. But actually, Arjun, after Jessica kind of shares, some things might cross your mind that you want to that you may want to intersperse. So you're not just relegated to the Rosa Parks section. You're in the front seat, and you can respond to what anyone else has to say. Jessica, please, and Jessica, share a little bit about you're a graduate student, correct, right?
Yeah, I'm a graduate student from the Yale School of Public Health. I'm currently on a gap year to work as a research assistant for CARE.
And I want people to hear that that's so important because, again, COVID-19, we don't want to have a COVID-20, and we need people. Arjun and Lily have gotten their medical degree, but maybe you can find the cure. That they haven't, so maybe the burden might be on you. So Jessica, share a little bit about your involvement thus far.
Yeah, thank you. As Lily mentioned, these sessions were so important for us to really gain community perspective. I was lucky enough to support her in this project, making sure that the logistics were set up. We had about 3 sessions throughout March with about 76 participants. And as Lily mentioned, one of the biggest things that we heard is that it's so important to listen to the community. And people share that the reason why this was so important is not only when it comes to the COVID-19 vaccine, but in general, when people are trying to access care, they don't feel like they're being heard by their healthcare providers. And they emphasized that they did want to hear from the providers online, by phone, audio. They wanted to feel like they had somewhere to go to get information that was correct, factual, where they didn't feel belittled for asking questions, where they felt like people were taking their concerns seriously. And as Lily mentioned, once we heard that, we realized we needed to have more sessions like this, more opportunities for the community to get their questions out. So in the past month, I'm sure Selena and Bernard could talk more about this, but we've worked with Cornell Scott Hill Health Center to have Let's Talk About It, which is where providers answer community questions about the vaccine. Selena has been hosting online workshops for the community in Spanish. There's also been Straight Talk, which is just real conversation about COVID, kind of like what we're doing on this radio show, and just creating those spaces for these conversations to happen. And I think all this connects to the idea that at the end of the day, whatever solution we find to COVID, whether there's a cure, it's about knowing what the community needs and how to implement these solutions. It's not enough to just have a vaccine. How can we get people to take it and build their confidence to trust it? I think you said you wanted to hand it over to, I don't know if Selena, you wanted to jump in and talk about some of this community power that I was mentioning.
And Selena is a community powerhouse herself, so she emanates the energy, and that's the key. I think, Arjun, that when you come in, I think you'll agree that if we share our positive energy, it'll come back to us. It'll expand. It can be magnified. So, but Selena, yeah, good morning and good to see you.
Good morning, Tom. It's a pleasure as always, and I'm an MSW student at UConn right now. Born and raised in New Haven. I'm in New Haven right now. And I'm getting my MSW at UConn in community organizing. So, community is very much at the heart of all the work that I do and hope to do in the future. And as Jessica mentioned, and Bernard and Lee have mentioned, really this is a moment of community power. Some may feel that oh, this is about doctors, but this is about us, having this moment of agency, whether individuals choose to do it or not, but I think it's a moment that we can really claim power over public health and really remind the medical institutions that this is a moment about centering people, centering patients, centering community as the center of the narratives. Because I feel like sometimes that can get lost. But again, to touch more on what Jessica said, we found that in the request for more listening sessions, a lot of people found that having a space to talk about their general concerns or to speak directly with a provider was an important way to ease concerns and improve vaccine confidence. So it's also that power in numbers. I'm not the only one who's feeling this way. Other people are feeling this way. I'm not unreasonable for this, and then to actually have this moment, it reminds me a lot of a public hearing session in that way. You're having your medical providers be accountable for your direct concerns, your everyday life. And for me, because I ran this Spanish speaking listening sessions, the power of family is really important in getting motivated to get a vaccine. One older woman, at the time she wasn't eligible for the vaccine just because of vaccine guidelines, but she's like, as soon as it's available for me, I'm gonna get it because I watch my granddaughter, which is so typical in Black and brown households where we live typically 3 generations. I know definitely in Latin America, 3 generations under one household. We also, in the Spanish listening sessions, found that there's an inherently internationalist perspective that we have to take into account, because people aren't just getting information about what's happening here in the US domestically, but also what's happening in their home countries. So someone said, you know what, my son, he got the vaccine back in my home country, he's fine. I want to get it too. A lot of us want to travel to see our family members that we haven't seen in like maybe almost 2 years at least, because of the pandemic. So the power of going with family is also apparent in the actual vaccinations now. So like my dad went to go get his second dose of Moderna. This is when Wilbercrest was open as a vaccination site. So I was working as a vaccine runner and doing some interpretation. So I actually got to bring the vaccine over to the provider so that she could vaccinate him. And that was actually a really beautiful family moment, because I was there. I got to see the end of this process, and I had gotten vaccinated earlier through my work with CARE, thank goodness. But with that, our whole household is vaccinated. So that really brought us, I think, really close together. And it was nice because he came towards the end of my shift. So afterwards, we got in the car, we got his medicine. I made him buy me McDonald's. It was great.
I happen to know your dad, so and he can be a little stubborn or a lot stubborn, and I'm letting the public know that. So congratulations.
Thank you. Well, he's been on board with the vaccine day one. But for me, the stubbornness was trying to get him to come towards the end of my shift so he could buy me McDonald's. But we've also seen as the Pfizer has opened up for those who are 12, we see that families, so this includes usually mom, but sometimes it'll be uncle if dad's working. Siblings will come in droves to get vaccinated. So like there was one woman who came with her family of 3 children, all like who are now eligible. Boom, 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 all 3 of them at the same time. Sometimes there are even 5 people that come together, but only one person needs to get vaccinated. So it's usually the older people that get vaccinated. So we see family being a huge source of support and motivation to get the vaccines. And so I know I've said a lot, so I'll pass it on to you, Tom, who I'm just going to pass it on to
Right. No,
our other guest.
Arjun, I want to come to you, but Selena, thank you so much, because Arjun, there is a political shift going on. There is a public consensus shift going on. I shouldn't say public consensus. Some people would suggest that we're never in the history of humankind have we been so divided in terms of our information and how we perceive things. So to lift up the unity banner is so important. And Arjun, just before I ask you to kind of share, Selena mentioned the global aspect, and I don't want to be remiss with this, with Selena having South American heritage, with Lily having South Asia heritage. Arjun, I'm not quite sure.
Yeah, no, my family's from India and
Asia again.
Countless relatives now.
And Jessica from West Africa, if you don't mind my saying that. So this is a global show, but this is a global issue as well. It's one world. But Arjun, please share. Let's hear from you.
It's great hearing all of them share the key things that we learned from the study. The thing I wanted your listeners to hear is that sort of what's evolving. To me, I'm going to share my weekend, and I'm going to share a few numbers, because to me they perfectly tell the story of everything we learned in this. The numbers are this: we are kicking ass in Connecticut. There really isn't another way to put it. We are tied for 4th as states go nationally when it comes to vaccination. And so, if you look at the news, you look at the top line stuff, you hear what people are talking about. As a state, we are 64% of people fully vaccinated, 70% almost with their first shot. If you look at the vulnerable group, the reason we made these vaccines in the first place, first and foremost, was to take our frail elderly and make sure they're protected. We are now north of 90% amongst those who are older adults getting vaccinated. And so we have done a great job of the initial part of this. What's happened, though, and where we're sort of sitting now, is if you just stop there and you just think about those numbers statewide, it's too easy to hang up. It's too easy to hang up the cleats right now and declare victory. What's unfortunately happened, and this is sort of where I think about my past weekend come in, and your comments earlier about how do we prevent COVID 2020, is how do we sort of get over this to the point where COVID is more of a historical thing that we talk about, as opposed to something that we overly consumes our life every day. And so I live in Hamden. My kids go to daycare in New Haven. I work in New Haven. I'm an ER doc at Yale. And so Friday, I went to go pick up my kid at daycare. And for the first time this past week, I was allowed to walk inside the daycare and pick him up in person. I got to actually see where he has spent his days every day for the past year, never been in there. Because why? The teachers are vaccinated and 96% of the parents are vaccinated. And so what we've done is we've made a shield in some ways, a shield of vaccination around these little kids who aren't eligible and who can't get vaccinated yet. And so when we do that for our communities, when we go out, we get a shot, it is not only about protecting ourselves, but about creating these shields around our kids and our communities so that we can move on in life. And it was the funniest thing. I went there to pick him up and I forgot about COVID just for a couple seconds. I pick him up, we go to Mill Rock Park, or Volano Park. A lot of people may know it in Hamden. It's just right there on Rock Road. And now this is a park where, you know, most folks are black and brown who go there. And what I noticed was it was very safe. I felt so safe. I knew it was safe because I looked at the numbers that morning, and around the state, almost every community was down to near 0 cases of COVID. Sure, Hamden and New Haven had a smattering, but it was pretty few. But almost everybody was still wearing masks. I overheard a couple people talking COVID conversation about how it was getting in the way of this, that, and the other. And so clearly we were in a different spot than we were a year ago, but COVID was still owning our lives there. Fast forward to Saturday, we go to a swim club up the street here in Hamden. And at the swim club, almost every parent's vaccinated. There's tons of young kids, obviously, who aren't old enough yet. A lot of the teenagers are vaccinated, could be. Nobody had a mask on. Everybody was playing. We were there for 2.5 hours, grilling, hanging out, swimming. And we get in the car to come home. And I look to my wife, who's an ER doc too. And so our life is COVID. And we looked at each other and we were just shocked because we had just spent almost half a day without saying COVID, coronavirus, SARS, hadn't even talked about it. Nobody mentioned it, nothing. It just had moved on. And so what it told me was, yes, we are doing amazing in Connecticut. Things are getting so much better. But at the same time, that opportunity, that freedom, everything that kind of comes with vaccination is unfortunately getting unevenly distributed around the state. If you're lucky enough to hang in a crowd where everybody else is vaccinated, then you get to have half a Saturday without thinking about COVID. You get to have, I called it my breakthrough weekend. It was the first time I had a chance on a weekend not to think about COVID. But if you're not, right, we're still in the thick of this. And so I cannot implore people enough to sort of think about how it is not just a way for you to sort of, you know, prevent you from getting COVID. It's a way for you to put that shield around your kids, but it is our way to not have COVID 2020. If we want to have some part of 2021 where we kind of get past this and we don't have to sort of have our entire life entwined in COVID with every little thing we do, or every time you get in and out of the car, do I need a mask? Do I not need a mask? Can I go in here? Can I go there? Can I take my kids over there? Can my family play with that family? Can our two families play with that other family over there? The only way out of that is to build that shield. And the only way to get that shield is all of us get vaccinated. And I think that that is, in many ways, the family story, that pro-social story that we heard from the interviews these guys did across the community, that it's hard to tell people about because they got to go out there and get vaccinated to feel it. And so the person who isn't vaccinated can't feel that in the same way. But I'm hoping that, you know, everybody's the ambassador in their own family. You're the ambassador to your cousin. You're the ambassador to your kids. You're the ambassador to somebody else. And so my guess is the folks who listen to the show, a lot of them are vaccinated. But you all know somebody who isn't. You talk to them, they talk to the next person, and that's how we get there.
Excellent. And Lily and Jessica and Selena and Bernard, I'm curious, and I'm not raising this to contradict anything that Arjun's just mentioned, but why is there then, or is there still a need though for future listening sessions?
Well, we're starting to jump into a different age group now that we were actually focusing on before. Now we're looking at 12-year-olds and up to go out and get vaccinated. So we're still not fairly through the process in its entirety. Yes, and I'm glad he said that, yes, we've come a long way, and we are one of the better states in the United States that has been successful in this process. But it still doesn't take away that we still have a percentage of our population that has not been vaccinated. And to me, that's just as important as those that have been vaccinated. Mm-hmm. So these 12-year-olds and up, you know, we got to get them to get vaccinated because they're important. Yes, is it less likely that they would get as sick as I would as an older adult? But it's not about that. You still got to go home. You know, they're going places, they're going out in the public, they're doing things in the public. As he just mentioned this weekend, people at the pool, jumping in the pool, unmasked. I mean, just so many things going on. And then you go home. And then you might have a grandmother or somebody, a parent there that hasn't been vaccinated. Remember the story of the father and the wife that were talking about it, but the father didn't make it. This was just recent. This is a more recent story. And so I don't want to see anyone. Yeah, I'm glad I'm protected, but I want everyone to be protected. I want a complete safe environment for every last human being that lives in Connecticut and beyond.
Thanks. And Lily and Jessica and Celine, about the listening sessions, are there some upcoming? We'll certainly help to promote that, but I guess I want to drill down a little further about the listening sessions are not a one-off. Communion with one another is not a one-off.
Absolutely, Tom. And I think our dream at CARE and with our community agencies is that these listening sessions even go beyond the pandemic, that we are continuing to listen to the community, because as we know, our communities know what they need, and they often know the best way to allocate and use resources in a way that we in the healthcare system don't have that knowledge. And so if we've learned anything in this pandemic, that beauty and importance of partnership, even beyond the pandemic. And I know Jessica, Salina, and Bernard are already preparing for some upcoming listening sessions. I believe, I want to say June, July. Does that sound right, team?
Yes, we don't have specific dates yet to share with you, but yeah, as Lily mentioned, definitely an ongoing thing, and that we'll share more information as those have set dates.
Excellent, excellent.
Yeah, and if I may add, we're also working with a partner through Urban Strategies to also address Latino outreach strategies from a Latino first perspective, a Spanish speaking first, because what tends to happen is we'll have everything done in English and okay, let's translate it, or let's get an interpreter. And so I think having something that's Spanish language first is going to be really revolutionary by putting those who are usually thought of last first, not because Latinos, Latinas are last, but because that's where we're usually placed in society. And I also want to mention, I was listening to a panel this weekend, and I'm really upset because I can't remember the name, but in terms of getting everybody vaccinated, it's like saying, okay, we know there's going to be a machete fight, but I'm not going to get a machete because everybody else is going to have machetes. I'm like, no, I want my machete. Like, so it's about making sure, like, just because everybody else has done it, like, that's fine, but we want to make sure that as many people as possible can get vaccinated, because that's how we're really going to, as our guest said, is really going to move forward and make this a thing of the past, to make sure that nobody gets it, and we can eradicate it as much as possible.
And Tom, if I could just add this one.
Please, Bernard.
Please. I want people to get to the point through these listening sessions to begin to formulate questions. I think you formulate questions is how you get answers. And just in my own belief, it says you have not because you ask not. And we want people to begin asking those serious questions that they may be afraid to ask, or whatever the reason you're not asking. Ask plenty of questions. And I think we would find a way to get you the right answer. None of us know it all, so we all depend upon each other to try to formulate what that answer would be. But please begin to ask those questions, and then you might be able to be persuaded to make the right decision.
Excellent, excellent. Arjun and Lily, I want to jump to something that we hadn't discussed before, and this is live radio, so I apologize if you're kind of caught off guard by the question. But we know that Asia is, and particularly India, and that area is suffering horrifically. Is there a U.S. or World Health Organization responsibility? I mean, because just when you're talking, Arjun, about this small little state, Connecticut, and our worthy success, my mind is still on global issues at the moment, into some way, just a one connected world. And I'm sure you probably, do you still have family in India, Arjun?
Yeah, we have a lot. In fact, it's a terrible story, but I'll share it because I think it almost speaks to the same kind of story Bernard just shared, which is my wife's uncle, who is of really well means in India. He's a full professor at a university. His daughter is actually the news anchor on the major local news channel. And he got COVID about 7 weeks ago. He'd had the first of 2 doses of his vaccine. The vaccines that they have access to in India right now are not nearly as effective as the ones that we have here in the United States, call it maybe half as effective. And so he got his first dose. He got COVID about 2 weeks later. He started having more trouble breathing. His oxygen levels were dropping. He went to the hospital. First time he got to the hospital, they said, well, your oxygen levels are still in the 80s. Here, we'd be shocked and put you in the intensive care unit. There, They said there's other people lower oxygen. We're out of oxygen. We're out of beds. Go on home and try to make it work. There's somebody, again, I said, who has all the means. He goes back home, tries to make it work. 2 days later, his oxygen is now in the 60s and 70s. They take him back to the hospital. The miracle he even got there. He waits in a line 100 long and ends up passing in that line. Total tragedy, 100% preventable. And it is, I wish it was our unique story, but if I talk to any of our family now in India, any one person has one family member with that story. That's not uncommon to a lot of communities in America going back to last year. If you ask a lot of folks to really push and ask and think about it, have you lost a loved one? Have you lost someone in your family? Did one of your friends lose a loved one from COVID? That is true. The difference between here and India is that we have everything, right? In India, he lives in a town of 40 million people that has as many hospital beds as we have in New Haven, Connecticut, with 126,000 people. He lives in a town in India with half the amount of oxygen for those 40 million people that we have in a town of 126,000. And so I am, we're still sort of working through and thinking about like how to best remember him, reflect on this and everything else. But it just makes me feel like we've almost taken so much for granted here in our own neighborhood when we have everything. We've got better vaccines. We've got all the hospitals in the world, all the oxygen in the world. And what's happening there could happen here in the sense that when you don't get pandemics under control, one variant turns into another variant, turns into another variant. The reason their vaccines don't work as well is because they couldn't get enough people vaccinated in the first couple months. And so the coronavirus had time to change and evolve into new versions. Here in Connecticut, if we can get everybody vaccinated, and this is sort of speaking to what Selena was saying, everybody else, is the reason we need to get everybody vaccinated, not just enough to sort of keep people out of the hospital, but if you can really get so many people vaccinated that we can tamp down the COVID that it can't get from one person to the next person, then it can't mutate. It can't turn into a new variant. And if it can't turn into a new variant, our vaccines keep working, and we'll be safer for a much longer amount of time. So, the global pandemic is so terrible, and it's expanding exponentially in some ways. And we are trying, I think, as a country to do what we can do to help. But, getting vaccines to India 3-4 months from now, too late. It's too late. What we can do is some things within our own neighborhood that I think that we have to.
Excellent, excellent. Lily, I see you shaking your head, nodding your head.
Oh, I completely agree with Arjun. I think the pandemic has shown us, as Salina mentioned, the power of community. And Tom, as you shared, our health is deeply tied to our neighbors' health. And we've seen this in COVID. This includes globally. So, Tom, I love what you said, that we are really a community in this together.
And Jessica, any comments in terms of, I'm not sure if you have friends or family, direct family still in West Africa and Ghana, but I just, this global thing is just on my mind. And people ask me what the Tom Ficklin Show is about. And I like to share with them, you can be anywhere on the globe, anywhere on the planet with internet access, and hopefully you'll find the show to be of interest. It's not just a localized experience. Just looking at your face, Jessica, I wonder if you have anything to share, because I was looking at your Facebook page last night, Jessica, and just seeing you and the smiling faces of your college undergraduates. I mean, just that symbolism of you guys were having fun, you were smiling, you're holding your arms around one another. I mean, that's the kind of the joyous celebration of love experience that we want to kind of cultivate 24/7, 365.
Yes, like now we look at media and what's happening in other countries. Remember, like a little under a year ago, like that's what we were going through, and we had no idea how bad COVID would hit. And even though we had the resources, we were completely overwhelmed. And I think that brings up the point that, like, even though people are starting to get vaccinated, like things, when you look at different racial groups, different income levels, you're still seeing the same sort of disparities, and people aren't being able to enjoy the benefits that we supposedly have in this country with having a better vaccine, having a better healthcare system. And in terms of thinking about an international perspective, I remember thinking about this in March, and I was really worried about my family in Ghana and what it would be like. And there were so many articles talking about what happens if COVID is in Africa, right? And I think part of that discussion really disguised the fact that, like, it was going to be a global problem. And I think we lost a lot of time, like, looking from afar and predicting what would happen there instead of preparing ourselves. And luckily, Ghana didn't have a huge COVID wave like some of its other neighboring countries. But even talking to my relatives and realizing like that was lucky, because the same problems we had here of people not wanting to wear masks, like, people attending functions and being like, this COVID thing isn't that serious. And it's just interesting how the commonalities like really go across like borders. And,
Yes.
we think about languages and culture and community, and we imagine that we're all so different. But I think this pandemic has exposed how similar we are and how important it is to get good public health messaging no matter what, because people are always going to care about the same thing.
Indeed, indeed. Pursuit of happiness, absolutely. July 4th is upcoming. Bernard, weigh in a little bit, because I think folks need to know that you're in constant contact, and share with your job title as well with the Centers for Disease Control in terms of their webinars and their information. Flu season is coming, and Arjun, I want to weave you into this discussion as well. But polio, mumps, infectious diseases this is not a new phenomenon. We have a new flavor. I'm not trying to be sarcastic, but we have a new flavor, but the infectious diseases might also be in existence in the future. So Bernard, talk about your involvement with, because flu season is upcoming, the CDC, and just the need for global health. And then Arjun, I want you to kind of share when you put your finger in the wind, or when you do your research or look into the microscope, what do you see in terms of the infectious disease world moving forward? But Bernard, first jump in about this. September, October, November will be here soon with the flu and students going back to school, and et cetera.
I mean, I'm the outreach education coordinator for Southern Connecticut State University, and I was hired specifically to run a flu campaign here in this past year. And as this COVID piece and the flu became actually a similar subjects, because of course COVID is not going anywhere anytime soon, but the flu vaccination and flu time is coming around again. And I want people to realize how important, and I've heard it many times. I've never been sick, or I've gotten sick, or multiple reasons why people don't take the vaccination. But I want people to understand how important it is to be vaccinated, to prevent what you all have just have shared. The story that the doctor just shared about what happened in this country to a family. I mean, it just broke my heart, because people don't take things seriously. This is why we have vaccinations, to protect you and to protect people around you. And that's kind of what we're doing. We're preparing ourselves now to come into the flu campaign once again, but also bringing COVID with it. So we're going to have a flu COVID campaign to help people to remember that it's still just important. And I believe I'm hearing, I don't know, and Doc may be able to step in and share with this point of view, as far as getting that booster, how long would the COVID vaccination last? And that's kind of what a lot of people are questioning. How long would it last? Would a booster actually come? And if that's the case, please take the booster. Please continue to take your flu shots. The reason why things were so great for the flu this year, where a lot of people didn't get sick, is because of preventive measures of COVID. People were wearing masks. People were staying a considerable distance from each other. People were taking those precautions seriously. Most of people, some didn't, but the most of us did. Yes. And that's why the numbers were so low. But what scares me most time is that the 4th of July is coming. The summer is coming. And as he said, most people are now taking their masks off. And that percentage that we didn't get to yet is still can carry this virus. So it's still important that we're still taking our vaccinations. One thing that I didn't want to leave out that I feel is very important is, yes, what's happening over in other countries is still very prevalent. Guess what? People are flying from those countries, and variances are changing, and they're flying from country to country. So when a variance change, guess what? They're bringing that variance with them. You know what I mean? So you're not being vaccinated can actually cause a variance to come back to the United States for those that are not vaccinated, that may be in effect the ones that have been vaccinated. So it's many things that can come out of this. And this is why it's so important, why I still represent getting vaccinated with all those vaccines that may be something that may harm you later on. Get your flu vaccination when it becomes available to you.
All right. Dr. Venkatesh, share a little bit. I'm sure you have some responses to what Bernard has mentioned. because this show is not a one-off. I mean, this issue of health and safety and actually, Dr. Vindicash, we don't have time to do it this show, but I was looking at your background in terms of policy and health and economics as it pertains to the healthcare system. You've written a lot on that topic, and I think that pertains to this issue, but we'll do that maybe on another show if your time permits. But what are some thoughts that are on your mind when you heard Bernard speak?
Sure, yeah, I love coming back to talk about all these stuff, especially with you and the team here. I think COVID taught us we learned a lot about COVID. We know different things today than we knew when it started. It also unearthed all kinds of problems we have in other major public health priorities. And so when I think about, what does public health look like? What do we do to keep our communities healthy? What do we do to keep our communities safe going into the fall? What came out of this whole pandemic? One of it was, like Bernard said, we learned that some pretty basic stuff, and probably the two things that mattered the most was washing our hands and wearing a mask, took flu down to almost zero. And unbelievable. Thousands of kids did not die this year from flu that have died year after year after year after year from flu. That's different than COVID. COVID doesn't kill kids, right? Flu does. And we now know we got to make a decision as a community here locally, as a state, as a country, and as a globe. How much are we willing to give and what are we willing to do moving forward to prevent those kids from getting flu and dying? I think that's a question we're all going to wrestle with. The simple answer on this, I'll drop a little science here, is we get lucky with flu versus COVID. Because flu, only 95%, I shouldn't say only, but 95% of the time only transmits after you're symptomatic. And so what does that mean? That means if you get vaccinated, we get over this COVID thing, we start relaxing rules. For me, the rest of my life, if I'm ever symptomatic of being sick, I've got a fever, I've got a cough, whatever else it is, I'm tossing a mask on. Because I know that if I toss a mask on, I'm not transmitting it. What's the other thing I know I'm going to do? I'm going to wash my hands like crazy when it's flu season or any of these other seasons. By doing those two simple things, we could essentially change what that flu curve has looked like for the next 100 years so that it's not what it was for the last 100 years. There's some other public health stuff, though, that comes up as a result of this. We are now seeing increased amounts of gun violence. We are also seeing increased amounts of opioid overdoses. We're seeing increased amounts of sort of a variety of other substance use disorders. And we're certainly, everybody knows there was already call it a near pandemic, but it has only been worsened and exacerbated in the mental health space. Both kids and adults, older adults, you name it, whole spectrum. And so I think what's going to come of this is we are going to have to make a variety of new choices as communities around what do we want to do to tackle what have been these intractable problems in health. I think we kind of let a lot of them smolder. We do a little bit here and there. We put a Band-Aid on to get to the next week or the next year, but we didn't tackle them head on. But if we can actually beat COVID, we start knowing that we can beat these big problems, and we need to do the same for some of these other issues. There's a couple pieces written recently that I thought were fantastic, which, somebody asked the question, like, if we put all the resources we had just put into COVID, into the opioid problem, how quickly could we get rid of it, right? And if you start playing that thought experiment about some of these major problems that we have in our communities from a health perspective, you recognize when people come together, they get focused on big issues, we get everybody working together, industry, governments, community leaders, doctors, whatever it is, all of a sudden we can start knocking these out. We're not going to knock them all out overnight, but one at a time. And so I think that the future is one where we take these infections serious. You're all going to wear a mask as soon as you get symptoms for the rest of your life. We're going to wash our hands like crazy. And then I hope, is that we take everything we learned, all the people we met, all the kind of new collaborations that came from COVID, and we start dealing with the rest of the world's problems, because there's more than one problem.
Indeed. We have about 8 or 9 minutes, and I want Jessica and Selena and Billy to kind of maybe make a mental note or jot down some of the points you might want to mention that we haven't had a chance to address head on. I want to give you time to do that, and Bernard as well. But Lily, I want to kind of mention, and Arjun in my mind alluded to this a little bit, not directly but indirectly, in terms of the mental state, the psychology of individuals, even the psychiatry. The rumor has it, when I looked at your background, that those words psychology and psychiatrist appear associated with your name. And I'm not being facetious or trying to make a joke. I think it is you've committed your career to this issue of the mind, and people use the term healing, but psychiatry and psychology, those are healing arts as well. I just wondered if you had any thoughts in that regard, given COVID and your commitment to your academic journey.
I appreciate you so much for your thoughtfulness and ability to know these things about us. And as Dr. Venkatesh mentioned, alongside the global pandemic of COVID-19, we have seen the issue and realness of mental health challenges in our country and across the world, and the importance of addressing mental health challenges and having resources and allocation towards mental health. And we've seen, like no other time now, resources also being invested in CMSA and our mental health agencies in a way that is truly remarkable. And the continued need to work with our communities and our organizations and our patients to be able to access those resources. And so I would say for anyone on this call who has experienced mental health challenges, concerns, know that you are not alone in this time. We have seen such, unlike any other time in our country, the challenges of social isolation, social distancing, the ways that we've seen structural racism exacerbate not just the pandemic, but access to care like no other time in our country. So I want the folks to know they are not alone, and reaching out to providers, wherever it may be. I actually work in a primary care clinic providing mental health. And so knowing that there are resources, and unlike our other times in the country, we're just seeing an increased access to these resources. And I'd love to open it up to Bernard, Jessica, Salina as well, because I know in your work with the community, this has also been part of the outreach that we do.
Please, Selena.
Just kind of bringing it back to family. There are people in my family that have heart problems. So for me, getting as many people vaccinated is definitely a life-saving issue, because I never know who I can. And even though, this individual has been vaccinated, everything, I'm not playing games with anybody's life. I don't know, even if I go to the grocery store, who that person is living with. But, again, bringing it back to family, also in the general sense is, if a family member is not sure about getting vaccinated, or they don't know, help them sign up, go with them, offer to go with them, have aunt, uncle, cousin, go with them, or even all of you, make it a little vaccine party to go and to go get vaccinated. And I think it's also so important that, as we do this, especially if you're a healthcare provider and you meet someone at the vaccination site who isn't vaccinated, it's always so important, again, ask and listen with empathy. Like, instead of saying, what are you waiting for? You can always ask, like, how could I answer your concerns? What questions do you have? How can I help you so that you can, so that you could entertain this idea more? So again, I think that we all have to kind of think of ourselves as, and as cheesy as it is, like, we do have to think of ourselves as one big family, because at this point, the pandemic has shown how interconnected we are. Someone that you only meet once, all of a sudden now there's 60 cases. So again, just kind of keeping that in mind, and how we can all support each other and make this, a moment of coming together more, instead of a moment of, and less a moment of fear and isolation.
Indeed.
What I hope to happen out of this is that people begin to take what happens to them medically more serious, and not put their medical services to the side. In this pandemic, a lot of times people stop going to their doctors for preventive services. And I'm suffering from that right now. My mom has stage 4 liver cancer, and I don't know how much longer she's going to be with us. So it's so important that you go into your doctors, not forgetting to get your checkups, not forgetting to ensure that you are totally healthy in all aspects, because you may be in the position that I'm in right now. That's why all of this is so serious. I like what Doc said, that we can't get so caught up in COVID that we do forget that there are other serious medical conditions that are still in existence as well. So please get your checkups. Don't forget about that. Go see your dentist, go to your doctors for internal medicine. Make sure you're getting checked out, period, in all aspects, because all of that is important. And so that's kind of where I'm at right now.
Tremendous. Jessica?
I think everyone hit on the key points. I just wanted to make sure that we mentioned some ways that people can get vaccinated if they're listening to the show, and maybe this has changed their mind. CARE's been working with a lot of partners, including Project Access New Haven, Cornell Scott, Fairhaven, New Haven Health Department. I did want to mention some clinics that Yale New Haven Hospital is hosting. So they're having a clinic tomorrow at 3 p.m. It's at Beloua Heights Church. That's 782 Orchid Street in New Haven. There's also, they've been doing a clinic initiative, but that would take place from June 12th to June 17th, anytime from 10 a.m. to 5 p.m. They'll also be doing those in July, and those are taking place with FEMA at Edgewood Park. I think the New Haven Health Department is also hosting vaccine sites at Long Wharf. So those will be happening Saturday and Sundays from June and July from like 11 to 5 p.m. at Food Truck Paradise. And people who get vaccinated also get a $10 incentive. So you also get a little benefit as well as being protected. I don't know if anyone wanted to add any additional clinics.
Yes, if I could add, Cornell Scott Hill Health Center on 226 Dixwell Ave. On Tuesdays and Thursdays, they're going to open at 8:30, and on Tuesdays they'll be closing at 4:30. On Thursday they'll be at that same location until 6. And then at Wilson Library Branch, Monday, Wednesday they'll be there from 8:30 to 4:30, and Friday that same site until 6 p.m. On the 12th, they're going to have the West River Stay Healthy Fair at West River Memorial Park. They'll be there from 1 to 5. And then Bereavement Care Network at Bible Gospel Center at Leader Hill and Hamden on the 19th. They will have another vaccination clinic from 9:30 to 11:30 a.m. And for anybody who has questions, the vaccine will come at no cost to you. No one can turn you away if you do not have insurance. They will ask for ID, but just to verify that you're the correct person. And even if you don't have an ID, they still cannot turn you away.
Indeed, and I believe
not because of a lack of resources, Tom.
Yeah, and correct me if I'm wrong, but I believe many of the opportunities that have just been articulated are on the CARE website. So just really recommend people go there. Arjun, before we kind of conclude, and Harry, our station manager, will play the music, and I always kind of push the envelope to get the maximum amount of time for the show. So let's go for it. But Arjun, I was curious, you've been involved, and I've heard you in a few meetings. You've been talking about social influence and the media and messaging. I think that's also going to be a dilemma for us moving forward. And I say dilemma because I'm a masochist. I watch Fox News every day, as well as MSNBC and CNN, just to kind of get a feel for the spectrum of beliefs and the spectrum and variety of folks that are trying to influence our behavior. But more specifically, I just wondered if you could kind of conclude a little bit and share about your interest in the impact, the importance, and if I can dare say, the potency of social influences.
We know that sort of, call it misinformation or some of this poor information, particularly in the social media space, is potent, effective, and it works. We've seen it work across multiple elections now, and it's really sobering. I read recently something that said that for every sort of one sort of fact-based, pro-social sort of statement there was around vaccination, there's, in certain people's Facebook threads, 10 going the other direction of misinformation. And so the reality is this, we don't have enough folks to get out on radio waves or on TV or in posting on Facebook to almost beat that back, because the misinformation world comes from a lot of automated algorithms and bots and all kinds of things that can literally put out some fake message every 5 minutes, 10 minutes. And so the only thing I can tell people on this, when I think about this, because I think it is an absolute real problem, if we could beat it back, there are many people out there where if their mind had never been sort of dirtied with that misinformation, we'd be having a very different conversation about vaccination and COVID and life, you name it, is to ask people to go to the people they trust, real people, real interactions first when it comes to information. And I think if you get real information from real people, and now those real people can't be feeding you what they got on Facebook, right? But what they got from real people, right? And that can be communities. It does not have to be doctors at all. It can be folks in your community, your pastor, whatever else it might be, other people that your kids play softball with, whatever it might be. That is where we're going to have the trusted relationships to push this message forward. And so what I tell people, like listeners of your show, is please go out there and be that trusted voice for one other person, because they are definitely going to scroll through their Facebook page tonight. They're going to get 100 or 200 hits of information going in that brain. Some of that stuff is going to be junk. Do your part to talk to them.
Excellent. So let's do our part. Harry's giving us the clip. Thank you, everybody.
I gotta listen, I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, feeling position.
This is Harry Drove, and you're listening to WNHHLP 103.5 FM New Haven.
Stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, let's camera action, I'm ready to